Hey y'all, it's Dr. Tiffany. I hope you're doing well. So a question I get asked a lot is what are how accurate are rapid tests and are they picking up new variants and whatnot? So I decided that I needed to make a definitive video about this. So behind me is a Cochrane review. For those who don't know what that is, that's something called a meta-analysis where they analyze the results of many studies. In this case, 155 different studies that encompassed 100,462 patients, 16,800 of them which had COVID. This is basically considered, one of the forms of definitively answering a question. So what they found, they're 73% accurate if you have symptoms at the time, which means that there's a 27% false negative rate. 55% accurate if you're not symptomatic. That's a 45% false negative rate. But in the first week, if you have symptoms, 82% had positive rapid tests. That's a little better. That's the often quoted 15 to 20% false negative rate, by the way. That's where that comes from. So false positive rates, for those who are curious, are 0.3%, 1 in 300, which is a little bit higher than I thought. I thought it was 1 in 1,000. And there's a few things that you can do, that you need to avoid in order to not get more inaccurate results. Okay, number one is if you want, one of the few ways to get a false positive is to drink Coca-Cola, coffee, or another highly acidic drink right before you take the test. You need to wait at least 30 minutes if you've had these things. You can get a false negative if you do it right after you brush your teeth or you use mouthwash, because good oral hygiene actually does wash out viruses if you're doing one of the oral ones. So the same would go for flushing your nose. Now, to be clear, doing that does not mean that it does not make the virus go away. That's kind of like trying to kill a forest by chopping down one tree. And the test needs to be performed at room temperature as well, okay? If it froze solid, it may affect its accuracy, and you certainly don't need to be doing it outside your event where it's like 16 degrees and snowing or something in your car. You're not going to get an accurate result then, okay? It needs to be at room temperature. So, and follow the instructions for the particular test very, carefully. That's another way you can get false results, is by not doing it properly or not going deep enough. Okay? I know nobody likes them, but they're a fact of life. I love you. Stay safe.